Hi, my name is Grant Scarp. This is my anatomical terminology project. First, we'll start off with some body regions. The cephalic, which would be your head, and then you have your cervical, so your throat. It's also a modified portion of your torso. And then you have your upper limbs and your lower limbs. Next, we'll go into some planes of motion. You have your frontal plane, which divides your ventral and your dorsal sides, front and back. And then your transverse plane, which divides your superior portion and your inferior portion. Next, you have your mid-sagittal plane or median plane, which divides you left to right, straight down the middle. And then your parasagittal plane, which also divides you left and right, just not directly down the middle. And then lastly, you have your oblique plane, which is anything other than a 90-degree angle. Moving on to anatomical directions. So superior, inferior. So your thoracic would be superior to your abdomen, and your pelvis would be inferior to your abdomen also. So anterior and posterior. So anterior part of your knee would be your patellar, and your posterior part would be your popliteal. Medial and lateral. So your oral, or your mouth, is medial to your octic, or your ear, and your octic would be lateral to your medial, to your oral. Proximal and distal. So that's dealing mostly with limbs. So your femoral would be proximal to your pedal or your foot, and your foot or pedal would be distal to your femoral. And then superficial and deep. So your heart would be deep to your ribs, and your ribs would be superficial to your heart. Hope you enjoyed that. Thank you.